Okay, this is a prosection of the lower extremity. I have a couple muscles on here, and then I'm going to go through some more. I'm going to start with the external rotators, the short external rotators, and that's a group of 6 muscles that externally rotate the femur. With one exception, their nerve is just the nerve off the sacral plexus. The obturator internus, which is the muscle I have on here, comes from the obturator membrane, which is just the covering of the obturator foramen, which is, this hole, and that comes to the medial surface of the greater trochanter. You have the obturator externus that comes from down here, the pubic ramus and ramus of the ischium, and actually goes to the trochanteric fossa. So those are your 2 obturators. And then you have the gemelli superior and the gemelli inferior. Now the gemelli superior is going to come from the ischial spine here, and then go to the medial surface of the greater trochanter as well. Now the inferior gemelli, actually, I'm going to take these guys off for a second so you can see this. It comes from the ischial tuberosity and goes to the medial surface of the greater trochanter. So it's actually is going to be underneath everybody else. Okay, so you have the gemelli, you have the obturators. Then you have the quadratus femoris, and that's also going to kind of go over a couple of guys. That's going to come from the ischial tuberosity, and it's going to go to the medial, to the quadratic tubercle on the intertrochanteric crest, but it's about in the same area. And then you have the piriformis. The piriformis comes from the anterior part of the sacrum, and then also goes to the medial surface of the greater trochanter. Right? So notice this is the skeleton's in a position of striding, so some of the muscles may look a little bit different in terms of their length-tension relationships, but those are your short external rotators. They all externally rotate. The obturator externus, remember this guy underneath, is actually, its nerve is obturator and can adduct as well, which makes sense because obturator is the nerve of the adductors. And then the piriformis, which as you can see comes over the femur, over the axis of rotation, can abduct, right? But otherwise they all externally rotate. Now I have on here the quads group. So the quads are 4 muscles, the vasti group and then the rectus femoris. And the vasti group actually covers most of your thigh. So here I have the vasti lateralis that comes from the lateral lip of linea aspera and then the gluteal tuberosity and parts of the greater trochanter, and it's going to wrap around to the front here to the lateral surface of the femur. And then coming back here again, you have the vastus medialis that comes from the medial lip of linea aspera and also will kind of wrap around to the front of the thigh. And that's going to leave off here. And then this guy in between here is the vastus intermedialis. So that's your vasti group, vastus lateralis, vasti intermedialis, and vasti medialis. And then it's not really clear on my prosection here, but you can actually divide the medialis into 2 parts. The VMO, the vastus medialis obliquus, which kind of comes at a bit of an angle, and then the vastus medialis longus, which is a bit longer. And then on top of that, you have the rectus femoris. And the rectus femoris comes from the anterior inferior iliac spine. It's going to come over everybody. And the vasti group and the rectus femoris will all converge onto the tibial tuberosity via the patellar tendon. So they're all going to come to the same spot. So the vasti group and the quadratus femoris are all going to extend the knee. The rectus femoris can flex the hip as well. Okay, but just the rectus femoris. So coming back over to the lateral side, I'm going to put on the gluteus medius and the gluteus minimus. The gluteus minimus is going to come from the anterior and inferior iliac lines, so that's about down here, to the anterior part of the greater trochanter. And then the vastus medialis, the gluteus medius is going to come from in between the posterior and anterior lines and come over to the greater trochanter. So it's going to kind of fill in. So remember, the minimus comes a bit more in front. Okay, the medius and the minimus are your primary AB adductors. The nerve for both of them is the superior gluteal. The minimus, because it comes a bit more in front, will flex and internally rotate as well. The gluteus medius can actually be considered a lot like the deltoid and can be divided into 3 parts. So an anterior part that will flex and internally rotate just like the gluteus minimus, and then a posterior part that can extend and externally rotate. So it's very similar to the deltoid. On top of the minimus and the medius is the gluteus maximus, and that is a very large muscle that everybody's familiar with. Okay, so its origins include the posterior iliac crest, the edge of the coccyx, the edge of the sacrum, the sacral tuberous and sacral spinous ligaments, which I don't have on here. And then it actually has 2 insertion spots. One part is the idea is it inserts into the IT band, which is a tendinous insertion that runs along the lateral part of the thigh. And then the lower part inserts into the gluteal tuberosity, which is kind of the lateral part of the linea aspera on the posterior thigh. The gluteus maximus, its nerve is the inferior gluteal. Its primary action is to extend the hip. It also can abduct, like the other gluteus muscles, and it also can externally rotate. The lower fibers, because it's so large, you can imagine that the lower fibers actually come below the axis of rotation, so they can adduct. Okay, just the lower fibers themselves. Okay, so now I'm going to go to the hamstring muscles, and I'm going to come over to this side so you can actually see them a little bit. So the hamstring muscles are the medial hamstrings and the lateral hamstrings. And so the medial hamstrings are the semimembranosus and the semitendinosus. So the they all come from the ischial tuberosity. The semimembranosus is going to come, actually let me use this guy. The semimembranosus is going to come from the ischial tuberosity and then come to the posterior part of the medial condyle of the tibia. Let's bring this guy over here. It's the semimembranosus. The semitendinosus also comes from the ischial tuberosity. It goes a little bit lower into the posterior, more on the medial lateral part of the tibia, or the medial proximal part of the tibia, and it actually inserts into something called the pes and cineris tendon, and there's 3 different muscles that insert into that. So both the semimembranosus and the semitendinosus can extend the hip as their primary action, flex the knee, and the semitendinosus will internally rotate a flexed knee. And the nerve is tibial, which is a division out the sciatic. The biceps femoris is actually has a long head and a short head, and that's going to come from the ischial tuberosity to the head of the fibula, which is over here. It's also going to have a short head that comes from the lateral of the linea aspera also to the head of the fibula. Okay, so that's your biceps femoris. Its nerve is also tibial. It also will extend the hip and flex the knee, and can laterally rotate a flexed knee. The short head, obviously because it doesn't cross the hip, is only going to flex the knee. The long head's nerve is tibial. The short head's nerve is the common peroneal. So those are the hamstring muscles. Coming to the front again. Okay, so here we have the quads group on here. So I have already on here, on the opposite side, I have the iliacus muscle, and that comes from the iliac fossa to the greater trochanter. And then you have the psoas muscle that comes from the, let's try to put this guy on here, comes from the transverse process of the lumbar vertebrae, and also will insert into the lesser trochanter. So the psoas major and the iliacus are typically combined to talk about the iliopsoas muscle. The psoas major has its innervation as the lumbar plexus, the iliacus, the femoral nerve, and their main action is to flex the hip. Also, the quads are all femoral nerve. I can't remember if I said that or not. So another flexor that I'm going to put over here is the tensor fascia lata, and that comes from posterior to the anterior superior iliac crest, and then it comes kind of from the posterior iliac crest here, and it actually kind of comes down and inserts into the IT band. Remember I said that about part of the gluteus maximus as well, and that's a thick tendinous insertion, so it's about kind of mid-thigh. The tensor fascia lata is a primary hip flexor. It also abducts, and it also can medially rotate the femur. It's kind of just barely. I know it's kind of hard to see that sometimes. Another flexor is the sartorius muscle. And I'm actually going to put the sartorius muscle over here. It comes from the superior anterior iliac spine, and it also inserts into that pes ancenaris tendon. Okay, so it comes from across. It's going to flex the hip. It can also externally rotate the hip, and it also can abduct. And then because it comes in the pes ancenaris and tendon into this lateral proximal medial tibia, it can also flex and internally rotate a flexed knee. And the nerve of the sartorius is the femoral nerve, which is the nerve for pretty much all the hip flexors, except for the tensor fascia lata. The tensor fascia lata is inferior gluteal, which makes sense because it's a major abductor. Remember the medius, the gluteus medius, the gluteus minimus, tensor fascia lata are all inferior gluteal. Okay, so now let's go to the adductors. So the adductors people tend to talk about in 3 layers. So the deepest layer is the adductor magnus, and I'm going to take off the hamstrings for a second here, so you can see that you have here, it actually has 2 parts to it. It has a what's called the adductor head and what's also called an extensor head. So the extensor head, the adductor head is already on here. It comes from, he's kind of fallen off a little bit, but it comes from the ischial and pubis ramus. It kind of drapes over that whole kind of bottom part of the pelvis, and then it inserts into the whole medial lip of linea aspera. It's quite a large muscle, and that's the adductor head. Its nervus obturator, and it adducts the hip. You also have an extensor head, and the extensor head comes from the ischial tuberosity and goes to the adductor tubercle. It's a little bit longer than I need it to be. The adductor tubercle on the posterior femur. So basically, it's going to extend the hip. It's nervus sciatic, so it's basically another hamstring muscle. So I'll put these guys back up here so they'll all be together. Let's see. So this was the where did that guy go? That's the short head of the biceps femoris. Here we had the semitendinosus. Here we have the semimembranosus. Okay, so remember the semimembranosus is part of that posterior, is on the posterior part of the tibia. And then you have, let me get a little bit short here. And then the biceps femoris, the long head, is going to also come from the ischial tuberosity. Okay, so that's all of your thigh. And notice that basically you have all this, the hamstrings are going to be on top of the quads. So the quads do wrap around there, but they're kind of back down there. So I'm going to kind of turn around to the front here and go through the adductors, kind of the last group here. So like I said, the adductors, the deep layer is the adductor magnus, and then you have that intermediate layer, and that's going to come from, that's the adductor brevis, and that's going to come from the inferior part. I'm going to take off the sartorius muscle here for a minute. That's going to come from the inferior part of the pubic ramus and insert into the medial of linea aspera. That's your intermediate layer. And then on top of that, you're going to have the superficial layer, and that's the pectineus, the adductor longus, and the gracilis. So the adductor longus comes from the pubic tubercle, and it also inserts into the medial lip of linea aspera, so it's going to be sort of on top of that adductor brevis. And then you have the adductor longus, and that also comes, or that was adductor longus. And then you have pectineus, and pectineus comes from the pectineal line of the superior pubic ramus, and then also inserts into that medial lip of linea aspera. It actually inserts into what's called the pectineal line and the linea aspera, and that's kind of the most proximal part of the linea aspera. So the adductors all adduct. They also internally rotate. The pectineus is also considered a flexor, and its nerve innervation is actually obturator and femoral. Adductor longus and adductor brevis, their nerve is obturator, as is the adductor head of the adductor magnus, and they're all obturator. The last part, the last adductor, and the one of the superficial layers is the gracilis. So I'm putting back the sartorius muscle here. And the gracilis comes from the inferior pubic ramus, and that makes up, so that's going to come in here, and that makes up the last part. Oh, it's a little bit short. That makes up the last part of our pes ansinaris tendon. So remember, the pes ansinaris tendon was the sartorius muscle. It was a semitendinosus, and now we're going to put the last guy on there, which is the gracilis, and that's an adductor, and that's the last part of the pes ansinaris tendon. And that is a prosection of the lower extremity.